Well, Senator, you've talked a lot about, in the past, about healthcare involves hard choices. Sarah in Minneapolis has sent a question in by email saying, what do you see as the most serious problem with our healthcare system? Cost, quality, or coverage? And you can't say all.
Quickly, I'll begin with cost, because I think if you can deal with cost, then these other matters can be dealt with. And so the cost of it is what stuns me. And while all the incentives in our healthcare system today are incentives for driving up cost, we need to reverse this and really turn the whole system on its head. If all we're talking about here is sort of tinkering with the status quo, all we're going to do is probably raise costs, maybe marginally deal with some of these questions. But today, unless you fundamentally alter how this system is going to work, then I'm fearful we'll be back here again 4 or 8 years from now talking about the same subject all over again. All the incentives today in healthcare are cost-driven. We don't provide the incentives within the system to do just the opposite in a way, and that is to encourage the incentives to have better lifestyles, to do things that are less harmful to you, to encourage businesses, to provide environments where people are safer. I come back to the point I tried to make earlier as well here, the incentives to have a cleaner environment, a better energy policy in the country. Seeing to it that we insist on schools, for instance, that you don't have to market fast food or junk food. 49% of the schools in the United States of America have contracts with soft drink companies and junk food companies, 49%. And then we wonder why kids have obesity problems. Then we wonder why they have diabetes problems, in a sense. So the cost issue, they do that because the money comes into a poor school district. They're struggling to make ends meet, so that exclusive contract that allows for that soft drink company to have a contract with them is very appealing to them to save some money. We need to deal with those underlying issues, in my view, as well, Karen. So cost, I would pick as the major issue. Yeah.
And given this problem is what it is and the urgency that people feel about it, what's your sense of what is a realistic time frame for getting to universal coverage? Barack Obama says it's 4 years. Hillary Clinton says it's 8 years.
Well, you know, I'm impatient in this. I didn't jump into this presidential politics because I woke up when I was 5 or 10 and decided this is my life ambition. I've been relatively content and happy working in the United States Senate. I've got these 2 kids, a late bloomer in the father business, obviously, as you look at me here.
What were you thinking?
Well, my daughter Grace was born 48 hours after 9/11 in Arlington, Virginia. You could literally watch the Pentagon burning from the hospital she was born in. I could watch her literally being born and see the Pentagon burn. And I've thought ever since that moment, as all of you who are parents or grandparents have, what kind of a life is she going to have growing up, watching those events? What kind of a world is she going to grow up in? And so I feel a certain amount of impatience in all of this. I think with the right leadership in the country that insists upon this being a priority. And I would tell you today, I wouldn't put a time frame on it, but I would make this the first order of business in a Dodd administration. This goes to the heart of our economics. It goes to the heart of who we are as a people. It goes far beyond the issue of sort of one set of issues. The danger in forums like this is because we have a tendency to stovepipe the issues. We're here talking about health care. What I tried to say earlier on to you is that what happens in the workplace in terms of job possibilities, income, salaries, retirement benefits, all contribute to the healthcare issue as well. Energy policy, environmental issues contribute to the healthcare policy. So while I understand the importance of having this discussion, it's important to realize it's far-reaching in its implications. So to me, I would want to see us have a universal program begin far sooner, with all due respect, in 4 or 8 years. I think with leadership in the country that makes this important, If you get rid of these permanent tax cuts for the top 1% of income earners, get this war ended in Iraq where we're spending $2 billion a week, $8 billion a month, then it seems to me we ought to provide the resources to really move in this direction. So I would make it a top priority in my administration. I wouldn't want to put a time frame on it because I think it's too important for us to get there as soon as possible.
Great. Thank you very much.
Thank you all very, very much. Appreciate the attention. Karen, thanks. Very much.
Well, I've been it ever since I was a kid at school. Now they love me